Welcome to the EMT Pro Podcast, where we deliver relevant EMS content from the field and the classroom each week. Episode of this podcast can get you 1 full hour of CE through our partner, emt-ce.com, so head over there for more information. I'm your host, Steve Williams, and with me as always is Dan and Holly. Guys, so happy to have you back. Say hi, and let's chat about what we're going to get into today.
So glad to be here, Steve.
I know. It's nice to be back.
It's been a while.
It's been a while.
We're getting better, though.
We are. I mean, schedules have been horrible.
Schedules are getting better, so we're going to be making more of these things.
Starting to realign.
Yeah. You guys been good?
Yeah.
Good. All right.
You guys should see all these
This is going well.
Great.
Yeah.
Super. Things are awesome. Today we're going to get into a really fun topic, and we're going to wade into some, I don't know, they're not political waters, but they're kind of industry political waters, I guess.
Oh, absolutely.
Mm-hmm. Yeah.
Do you want to talk about what we're going to discuss today, Daniel?
Well, we're talking to these guys about EMS conference in Coeur d'Alene, and I was just amazed about how positive they are about EMS and transport. And that's just so different from the waters that I swim in.
Mm-hmm. And you're talking about fire EMS
Fire-based EMS.
Mm-hmm. Yeah. So we're really going to be talking about the differences between fire-based EMS, private ambulance EMS. We'll even talk about third service EMS a little bit.
Yeah.
I have a little bit of history with that. But yeah, interesting stuff for sure, because that you don't typically hear people in the fire service that are pumped about EMS.
No, not at all.
And you can probably name that one or two
that
members
nerd,
of your department.
Yeah, that's been me for 25 years.
Probably that nerd too, which is why we do an EMS podcast. But
yeah.
But yeah, I was really excited to hear you had found some new connections in the industry that were just as pumped as we are about it. And sounds like there's some pretty fun guys to talk to as well.
Yeah.
Cool. Holly?
We'll see. No, I remember being on scene once with some firefighters, and I worked for private ambulance, and my partner was having a little struggle with the firefighter on scene, and he goes, "You're a 10-minute medic, and you're about 15 minutes in over your head."
Oh, wow. That's perfect.
Wow.
But I think a lot of firefighters like that 10-minute medic mentality, you know, just not saying anything bad, but I mean, they really are on scene for about 10 minutes and then they get out of there. That's a perfect scenario for a lot of people.
Yeah.
And actually where I work is 5-minute medic.
5-minute medic. Yeah.
Mm-hmm. Yeah.
It's pretty awesome.
Yeah. And
so a guy, speaking of the time thing, we had a guy who used to work for us who he would show up and, you know, he always gave himself a timer in his head or on his watch. And then he always wanted to know if he showed up on scene and if they had time to get some stuff done or if they were behind. And so he would turn to you if it was a serious call and be like, "Hey, Steve, we're behind." And it'd be like, "Okay, I don't know what that means." But in his brain, it was things needed to happen days, minutes, hours ago. And here we are showing up when we show up. And we've got to do something about it.
And you're already behind.
And he'd be like, we're behind. Okay. Wow. I guess we got to get going. So that just meant move fast, essentially.
Right.
And
there's a time to move fast, and there's a time not to move fast.
For sure. Okay. Yeah, so we've actually got them on the phone, and I think it's going to be a fun podcast. So let's introduce them.
Okay.
Do you remember their names?
I'll introduce them.
Just kidding.
I'll introduce them. How about that?
Go Holly.
So we have Eric as well as Jeff, and we met them at a conference we were just at in Coeur d'Alene, and they're from the north, very, very exclusive up there.
Washington State. Yeah.
Mm-hmm.
Yeah.
And so we're standing there. It's kind of the end of lab, and I'm just kind of standing there, and this guy walks up to me, and he goes,
"Free for coffee."
So that did kind of sound like where it was going.
Yeah.
Even
like, wow.
better,
Wow.
an even
So
better
yes, sure.
line was, "So can I do a crike on that cadaver?" And I was like, yes. Finally, someone asked if they could do something fun today. And we were just kind of waiting around to see if anybody would ask. And so Jeff was the one. So he got to do the first and only cut.
So that's
on
Jeff.
that guy. That's Jeff. Mm-hmm.
And then who's the other guy that we're bringing on?
And Eric is, I don't know, Eric, are you his boss? Kind of? Are you like the big guy? He's the medical officer for the agency that they work for. And so he was there as well, get to do some fun stuff. So it was really cool to talk to them about EMS and not just the fire side of everything.
Because they were so positive. That's what drew me to them.
Yeah.
You just don't see that from that type of an agency.
And so I think so we'll get into it, but I think they transport, they do the fire stuff. I think they have a combination of short and long transfers as well. So lots of exciting stuff up there. So let's get in it.
Yeah.
Yeah, we were super stoked to meet you guys there. The cadaver lab was great. Just a little bit about me. I have about 11 years in EMS. I was an EMT for 5 years before I went to paramedic school. Been a medic for about 6 years. The last 4 of those with the current agency that I'm at. A little bit about our area. We run about 10,000 calls a year, and we're a little over 100 square miles. So we do have some rural EMS, kind of longer transport times. We're just west of Seattle. We're a combination department, so we do a little bit of everything. We do our own transports, and then we run the fire side as well.
Awesome.
And this is...
Yeah, and then on
just make sure, that was Jeff.
That was Jeff. Yeah.
Cover that.
Should I say that?
No, you say whatever you want, man. We'll make you sound good once we edit this thing.
Steve's amazing. All right, go ahead.
And then, my name's Eric Chamberlain. And like Jeff, started off with private for the first 5 years of my career, and then transitioning into the fire service. I've been doing that for 10, paramedic for 11 years. And then Jeff pretty much spoke to what our agency does here in the Northwest. We do have some longer and shorter transports. We have one hospital within our county that we transport to the majority of our patients that has different leveling degrees of capabilities. They're a level 1 cardiac, level 1 stroke, but only a level 3 trauma center. So our next level of trauma service for level 2 would be about 30 to 45 minute transport time by ground, or we can transport by air for level 1 over in Seattle.
Nice.
Yeah. That's similar to here. Like you guys have a level 2 trauma center in this area. So do you guys take all your traumas to the level 3 no matter what? And then transfer
depends.
later?
I have my own personal kind of triage trauma tool of if I think that it can be handled by our local hospital or level 3 trauma, then that's going to go there. So, but if it needs to go over to level 1, then I'm going to fly a patient, and then my third level of triage is the coroner. So,
Yeah.
The most stable patients
Right,
go
yeah.
to that level 3.
So the majority of our more severe traumas, I would say we send over to our level 1 trauma center.
Cool. Well, it sounds like you guys both have the experience as the private sector or maybe single role medic at the beginning of your careers, which might be why you're pretty passionate about the EMS side, because that's what you started out really focusing on. Bringing that into the fire service, do you feel like your agency is pretty heavily supported on EMS education, or is it more of everybody's focused on fire, or what is it like up there?
I think it's definitely a cultural thing around this area. I would say within our county, there's the big emphasis on EMS, at least I like to think so. And me being in my position as a medical officer, that's definitely something I try to empower a lot of our providers to continue with, one, their training, two, their education. We have a lot of younger providers within our agency, like Jeff, who are very passionate about EMS, very passionate about being a true practitioner of EMS, and they're always trying to hone in and improve on their skills. Obviously, if you saw that from Jeff wanting to cut open necks at the drop of a dime or the cadaver lab.
That's awesome.
And to build a little bit off what Eric talked about, like transporting to that level in trauma center, or kind of how we go about that. And Eric mentioned, I have a personal tool, and I think our county is super good. We have great protocols that we operate under, but our MPD and our delegates that we work for are very supportive of us. And, as long as at the end of the day, do what's right for the patient. And as long as you can justify that, we can, I don't want to say do anything, but for lack of a better term, you know, as long as it's in their best interest, we can stretch those protocols and we have the freedom to make decisions based on what we see in front of us versus kind of a checkbox protocol system, if you will. So I think that was a huge draw for me to come over to this area. I'm not originally from
north
where we work. From the north. I'm actually from your guys' neck of the woods. So that was a big draw for me to come up here and to keep me motivated of, you know, do the right thing, treat the patient, not the protocol book.
That's a really important thing that you said about having a good medical director that supports you, because if you have that, then you do feel like you can work to your full practice or your full ability, make those decisions on your own and use your protocols as a guideline, not a Bible.
Right. And there's the trust. I mean, the medical director trusts these guys. I mean, the agency I work for, we probably have 300 just paramedics, just straight paramedics, that firefighter paramedics, that our medical director can't trust all those dudes, and I certainly wouldn't.
Yeah.
So, Jeff, I'm going to point this towards you, buddy, since you're younger.
Yeah.
Let's start from the beginning. What drew you to EMS? What kept you so positive up there? Because you and I had a conversation up there about promotions and, you know, not being able to function as a paramedic, and I'm so not used to that, because everyone I work with down here, they call it, I got to get off the box. I'm a big firefighter, you know? And what is it? We have a lot of younger people that listen to this podcast, and I just want them to hear from you. How do you do it?
Oh man, I think that is a great question, Dan. I'm going to do my best to answer it in a reasonable time frame. I think it started, where do I even start? I think it started before I even knew what I was getting myself into. I grew up with my dad being a first responder. He's a law enforcement officer. And so I was brought up kind of in the culture of first responder and, you know, that line of work. Of course, he pointed me in the complete opposite direction to the fire side.
Smart man.
So my game plan was, I want to be a paramedic. I didn't even know what a paramedic was, but that's what I wanted to do. And I had this awesome plan of just graduating high school, going straight to paramedic school, getting a job and working, and not even knowing what that meant. I ended up going to the local fire department where I lived, which was a bit of a combination department. They had full-time paramedics, but everyone else was kind of part-time and or volunteer. And I met some of, you know, my biggest mentors, not only in my professional life, being a paramedic, being a firefighter, but in my personal life. And so just learning from them, being brought up in a system that was positive, that was EMS heavy, kind of shaped me into, I grasped onto those mentors who, I mean, that's why they were there, was for the medicine, was to be the medic at that agency. They actually didn't even do any fire, even though we were a fire department. They were just doing the medicine side of it. And so getting into this, I didn't even know really what the fire service meant. But then kind of, Dan, as you touched on earlier on, the schedule, the pay, the training, the mindset, the bigger picture, working private versus going to the fire service, kind of all the signs pointed me towards the fire service. But I mean, really, again, starting out medicine based, the fire service was kind of my second love, if you will, with EMS being my first.
You were looking at stability. You were looking at just your future. And there's much more stability in the fire service, right? And you get the training, you have the support. Is that what you mean by looking at the fire service? Do you know what I mean?
Absolutely. I did a short stint of private ambulance work, and it's no secret for all of us that have done it. It's pretty hard charging. I mean,
you're not going to be 72 retiring from the ambulance,
right?
Yeah, and I mean, at least where I worked, it was a great agency, and I'm so thankful for the opportunity. But I don't think I trained once. Like, I got to work,
right,
and I was put on the box, and I was out on the street until I got to go home. There was no training. There was no follow up. There was no.
There was no drilling. There was no.
Yeah.
Yeah.
It was kind of like, you know what you know, and especially being a younger medic, being in a system like that. Like, congratulations, you're on your own. Well, I don't even know what I don't know.
Right.
And now I'm out here, having to do that. Versus, I mean, stability. I think you hit the nail on the head, Dan. In the fire service, it's almost 100% train driven. Everything we do is like, you train on it, you get good at it, and then we adopt that into our operations. Versus, I feel like my experience with private at least was the opposite. Just go figure it out in the field.
Yeah.
And train on your own, or figure out your own way to work on your CE.
Right.
So,
yeah. I at our department where I'm at, we have it's said more than it's probably accurate, but it's definitely at least acknowledged that training is the number 2 reason why we're at the department when we show up each day. And so obviously responding on calls, being there for the people in our community, that's priority number 1. But then training so that we can, show up and fix problems is why we're there for reason number 2. And then everything else is, tertiary at that point. But I think what I want to get into today, and that was, thank you for giving us that info. That's awesome. I didn't grow up with any sort of first responder mentality at all. Had a dad in business, had a mom who was, my mom was a nurse, but never discussed the, emergency side of things. She was an OB nurse and worked that for a bunch of years. But the idea that the fire service is where you want to be that was told to me early on, even in my private ambulance days as an EMT, working on a 2-person medic with a paramedic partner. And so I guess that's kind of what I want to talk about. Like, I know usually the conversation ends with it saying, oh, well, the reason fire is better is because it comes down to the almighty dollar. The private ambulance world is operating on contracts, and the cities that they, put a contract in for their, a bid process essentially for, the rights to have the ASA, the ambulance service agreement in that area. But this is such a sticky point, right? Like, there are amazing private ambulance medics.
Oh, absolutely.
That do an amazing job, that kick ass every single day they come to work. And I enjoy those people. Like, they're awesome. And then we have people that go work for the fire department whose job description includes EMS every single day.
And 90% of their calls.
Right. And 90% of their call volume is EMS driven, and they don't want to do it. They don't engage during training. They kind of tune it out. And so there's this big dichotomy, and I guess maybe it's every industry, but.
Is it a culture though? Is it a culture in the department to be that way? Or is it just?
I'm sure it really depends on where you're at.
Yeah.
And
probably how big the department is.
Individual crew.
Yeah.
And I think there's, we've talked about generational differences with some of that, but that's also, I mean, we have probably 4 or 5 generations covered with this phone call, and how many, we're all passionate about EMS, so it's possible that every generation has it, right? But I don't know. It's an interesting phenomenon that it really depends on the person. But yet, for example, I know some people that are near retirement who feel like EMS was added to their
To-do list.
original
Right.
job description.
Oh,
And
wow.
they don't feel like it was something that they ever signed up for. But it's something they still take a paycheck from. And it's something that they still, choose to not engage in. And then I have people who have recently retired who were probably in that same boat, but went to paramedic school so that they could be that highest level provider on scene because it got added to their quote unquote, job description. And they became some of the most amazing and what's the word I'm looking for? Impactful paramedics that our organization's ever had.
Mm-hmm.
So
for you guys, we have 3 different departments kind of on the phone call here. Mm-hmm. What is the percentage of EMS training versus fire training that you get? Is it 50-50? Is it like mostly fire with a little EMS
Are you
sprinkled
talking
in?
legit?
Yeah.
Legit?
Yeah. Because we're talking about
Right,
the
legit.
fire service being like at the private ambulance, you don't go to work and drill.
Right.
Right. But at the fire department, you guys drill all the time. You're always training. So what are you training on? Are you training on mostly fire?
don't do do both. What's the typical monthly breakdown for you at your department, Dan, of training hours?
It would definitely be fire.
Well, right. But
Okay, so it's
give me an idea of how many.
So I work on a truck. So we have a lot of truck training we have to do, and I like to call it big truck. So it is probably, I would say, because we drill every shift, so probably 2 hours a day. I'm going to say, we work 9 days a month, 70%
What's the
fire.
calculator?
Yeah.
70% fire.
Get the slide
and
rule
the
out.
money all lies where the fire stuff is. The progressive
Right.
hose stuff, all the the big water shit. It's just, and then you try to get a cadaver lab to a department that's intubation success rate is 70%. Oh well,
Nah,
we don't need that. So yeah, it's definitely on the fire side. The money
Okay.
is.
Yeah.
How about you, Steve?
So we are required to get 20 hours of training a month. We work 10 shifts a month. And it's 17 hours of fire and 3 hours of EMS.
Oh, shit.
Okay.
And so what is that?
You don't have to do the percentage if you don't want
Right.
to.
I think that's
I mean, you have a master's degree, so
85%.
Thank goodness.
85% fire, 15% EMS.
Okay.
Yeah.
and then how about you guys?
How about in the north?
Being with this agency for 5 years now, and I think Jeff can kind of see it as well too. It's heavy fire training. I would say when I first started, it was probably like 80-20, and EMS was kind of pushed off to the side of the training algorithm. It's definitely something that I'm trying to even out on both sides, but it's hard to do because we're a fire-based agency.
Mm-hmm.
And a lot of trying to motivate guys to do EMS training, you'll get a lot of, well, we do this every day. Like, this is the primary job that we do is EMS. So why do I need to train on it when I can go out and run a call and do it? So I would say for us now it's probably about 70-30, but it was probably 80-20 in the last 3 years.
Yeah. I mean, to be fair, there's a lot more to the fire. It's not just fire. It's all the...
Oh, Holly.
No?
Don't buy into that. A monkey could do my job. But thank you.
I was just trying to be fair. No. Yeah. I mean, I think that's funny because in the flight service that Dan and I worked at, of course, it was all EMS, all medical training, like zero. I mean, maybe a teeny tiny bit of like helicopter operations.
Right. But the training was, we're in front of a computer.
Right.
And then go upstairs and sign yourself off on airway stuff.
Yep.
So there wasn't anything organized except for Advanced Skills Day. And that was just, go see your buddies.
Right. So.
Circling back to culture a little bit, again, Eric and I can only speak for where we're at, but Dan and Steve being on the fire side of it at your agencies, I think that we do a really good job of setting that tone here. In our hiring process, there is an EMS component, and then as the new hires are onboarded, especially with Eric now, we're doing Eric, jump in here, but at least a couple day EMS academy before these individuals are even coming to the line to us to make sure that they are squared away on their EMS skills. And then even as we hire paramedics, being a paramedic on the line, and I think it starts with, comes from our MPD, but it just department wide, like we have the standard, the culture, if you will, of greatness. Like if we hire someone and they're not performing, it's not going to be a secret. That will show on their daily evaluations. And we have enough of a culture here that, like, if someone, has that attitude that kind of Dan was talking about, like, I just got to make it to 366 and I can put in for the spot on the truck or put in for the spot on the engine. The other thing that's a little bit unique about us is there's not really another option. We have 2-person companies. So if you kind of know what you're getting yourself into here, there's not, you can't go put in for a spot to ride backwards, if you will. You either have to promote to a driver or promote to an officer position. That's really the only way off of the ambulance. So coming into this and knowing our department model, speaking for myself, like I knew I was getting myself into that. And that for me was, a little bit motivating. Like that's what I want. I want to be on the ambulance. I want to do paramedicine. I want to do the fire side as well, but I get to hold that, the paramedicine first, and everything else is just comes with it, kind of.
So once you promote at your department, then you're on the truck or the engine, and you don't go back. Like you don't move around. You promote, and now that you're the officer or the driver.
Yeah.
Got it.
Yeah, and that's your position. And like I said, we have two-man company, so an officer and a driver on either the engine ladder or we have a heavy rescue. And specifically for like our medics, once they promote within our department, the officers don't maintain their paramedic cert, so they revert back down to an EMT. And some people want that. Some people try to hold on to that paramedic cert as long as they can, but it's just not something that our organization currently supports as you promote up through our promotion process.
Wow, that is tough.
Would that be tough?
That is very tough to hear. We're at our department complaining and moaning vehemently about 3-person engine companies. So to hear you guys are operating with 2 is humbling, to say the least, because that's, they have all these studies that they've done that show the amount of work you can get done with a 2, 3, 4, and 5-person company. And 4 is actually the most productive number on a fire call. Like substantially more than 3, and actually like 5% better than 4% than a 4-person or a 5-person. And so, wow, you guys are working your butts off.
Exactly.
So if you have a 2-man crew, you go to a fire, does the ambulance come then as the backup? Because you can't have both of you in at the same time.
No, that's exactly what we utilize. So our medic units or our aid units are that quote unquote 4th man staffing for that engine company. So
gotcha.
They'll either get assigned to that company to work for them. And that's how currently we operate, to not necessarily make up that manpower difference, but to be utilized as a full quote unquote 4-man company. Yeah.
So Eric, I got a question for you, buddy. So in a large department like I work at, I can hide for 25 years. I can, we have a cardiac arrest where there's 12 people on scene. No one really knows if I'm any good or not. Same with the fire, you have first alarm where you have, 50 dudes doing whatever they do. I can always be in the background, just not doing a stellar job. Smaller departments, you're front and center the entire time, whether it's EMS or fire. What was my question?
Can you hide?
Oh yeah. Yeah. Thank you, Holly.
You're welcome.
I tuned you out. I got lost.
Oh, shit's sake. So Eric, you know your dudes, and you know their capabilities. Are you able to hide? Is what I'm thinking correct? Are those people pretty obvious who are not very good?
Yeah. Yeah, like I said, we're not a large department. We have about 100 line personnel, and 22 of those are paramedics. So no, you can't, not at all. to answer it easily. I respond to, at least when I'm in the office, to all of our cardiac arrest cases. So it's front and center that I get to get out there and witness, or at least peek in from time to time, of how our paramedics providers are doing on the field. And you can't hide from that. And which is, I guess, a good thing, because it allows me an opportunity to check in with them, to see where they're at, to see where we need to be at with our training. Maybe it's not a provider problem. Maybe it's a whole department systemic problem that we need to address. And it's easy to hide off in the shadows within our department.
And see, I think that adds to the culture of, you got to be good at your job. Like, you're working on the ambulance or the box or whatever you guys call it. You got to be good at it, because we're watching, and you can't hide, like you said, in the background. So maybe that breeds that culture of, if you come here to work, you're going to work, and you know what you're going to do. So you better like it. Right.
Yeah.
Well, and with that too, like on our medic units, you might be the sole paramedic for that station. So sometimes we have dual medic units, which is nice to be able to bounce things off of another, a paramedic provider. But I would say the majority of the time, the person driving you that day is an EMT, and then everybody else on your crew out of that station is EMT. So they're all looking to you to be that good, to make sure that you're honed in on your skills and you know what you're doing. And that's something as a department that we expect our paramedics to be able to do, like to be at their best, every day, because it could just be them on a significantly critical call.
And so just to dig deeper into what you guys, how you operate. So if it's a BLS call, does the EMT take the call, or does the paramedic always take the call?
We bounce back and forth depending on the call. If it comes in BLS and truly is a BLS transport call, then the EMT will be in the back. If it's an ALS call, then obviously the paramedic will be in the back.
Gotcha.
And then if it's a dual medic, then they rock, paper, scissors.
Right. Okay.
When I worked on the ambulance, I worked with the EMT basic, and I got to say, like, she was the best paramedic partner I ever had. That wasn't a paramedic.
Yeah.
It's a great relationship. She saved my ass a couple times.
Yeah, you get a good EMT. Yeah. No stopping you.
Jeff's regular partner is really good at that. We call him the paramedic shepherd.
Yeah, he's there. You guys met him. Yeah. He was
that's right.
at this conference hanging out. Yeah.
Oh, that's awesome.
Wow. An EMT at an EMS conference. Amazes me.
Yeah,
I never once went to an EMS conference when I worked on private ambulance, because they're expensive.
Yeah.
I couldn't afford it. And I didn't have any time off either. So, yeah.
And you're right. As an EMT, that thought never even crossed my mind. I became a paramedic. But yeah, we do have a couple providers that are really, really geared towards EMS and want to participate in stuff like that. And we totally push them to do things like that.
And Jeff, you said that you have one dude that's been there a long time, an EMT that's been there a long time, that's never promoted up because he likes being on the box. Is that true?
Yeah, we have. Go ahead, Eric.
I was just about to say that's your regular partner.
Yeah, my regular partner is 20 years as an EMT, and he is a better paramedic than I am.
Wow.
That's
incredible. I'm so lucky to be able to work with him, and his attitude is unreal. The positivity that dude just spews.
How?
But
How does that
we even
work?
have.
I get one transfer and I'm pissed. God damn it.
I mean, perspective, I guess perspective for me, at least, like, we were just in another workshop, and somebody mentioned, living your interview every day, like kind of waking up in the morning, remembering those things that you said that got you here, and I guess falling back on them and like, this is legitimately my job. Like, if my job today is to go see the same person 6 times, finally convince them to go to the hospital at 2 a.m, like, that's what I signed up for. It truly is. So, like,
You're right.
And not to just jump on the money train, because I mean, clearly that's not why any of us are here, but
that's why we stay.
I get the schedule that we have, the benefits that we have, the time away from work, and like the pay to drive people to the hospital. And
it could be worse.
The ones that make you the ones that make you frustrated are never the intubations or the CPRs or the multi-system traumas, right? Like, those are the ones that you live for. But to get upset about the easy one,
right?
At least working with that 20-year guy, he's like, "Are you kidding me? Like, we just went to Safeway and bought stuff for root beer floats tonight."
Yeah.
Like, why are you mad that you didn't even have to transport? Like, you drove me in. I have to write the report. Why are you mad?
Yeah.
I'm like, oh, well,
damn
I
it.
have nothing to be mad about. You're absolutely right. And we even have at least 2, without even really thinking about it, 3 paramedics, Eric, jump in here, that are at, one of them is at 30 years at least in EMS, if not more. And the other 2 are at 20 plus, and they are paramedics, and they're going to be paramedics for forever until they leave us.
Wow.
Yeah, they're happy with that position without promoting. Yeah, and they're that's what they signed up to do. That's what they love. It's what they're passionate about.
Which is really cool when you think about leaders. You don't have to be the top dog to be a good leader. Being a good follower sometimes is the best leader. And those types of people in that mid-level position tend to really, I think, push the culture in a company more so than the chief or the assistant chief or the captain even. So it's cool that you have those guys like that.
Absolutely.
Yeah. The thing that I was thinking about was kind of we've all seen the differences between how we felt or how we were treated, or maybe the emphasis when you get to work each day of working in the private ambulance sector. And I know that you can't paint with that broad of a brush, right? There are spots to work in this country where a private ambulance gig is a pretty sweet thing. I don't think it's overly common for that to be the case, but I know of a few places where people really, really love their job. And I wish, we don't have anyone that's in that boat, so to speak, right now that's on the call. But I remember doing my internship in Austin. We had, and I'm assuming they're still doing this. This was a few years ago, but they do a third service. So you basically have, in the branches of local government, you have, for first responders, you have police, fire, and EMS. And the ambulance posts or stations are at fire stations or, right near one, kind of a thing. And that was of all the 3 out there, I think it was probably the most interesting to me, because you're really part of this one big group of people. Like, something about tying in EMS and making this police, fire, EMS triad, I don't know what it was. It just felt way more uniform. And I actually really, really enjoyed it. You're still part of an overall city government, county government type situation. You've got good funding. They pay well. They have lots of opportunities to promote to different spots and specialty teams. But yeah, there's so many different things out there. But at the end of the day, I think overall, people are told, man, go get a fire job. Like, and I wish, guys, before we called you up, we were talking about how rare it is to hear of pro EMS firefighters. And most departments, you could probably pick out like the 1 or 2 dudes who are really into it. And And Dan and I were looking at each other like, yeah, I think that's us. We're those nerds. But it sounds like you guys are kind of a unicorn in the sense that your department has a handful of them.
Yeah, I would say yeah. But for our department specifically, that was probably not always the case. Which definitely has been a culture change within our organization and our area, and that's been driven by the large amount of people that have been hired over the last 10 years. Since kind of the recession time where where agencies weren't hiring, there's now been a significantly large retirement boom or bubble burst to where we're hiring 10, 12 people for our agency specifically over the last couple of years. And a lot of those guys are younger guys and gals coming from private ambulance or coming straight out of paramedic school or EMT school who have that school passion of continuing that care. And that definitely has changed the culture within our organization.
Well, and not everybody wants to be a firefighter. I mean, it's okay to want to work on an ambulance and be a paramedic. We didn't have single role medics at the fire service when I was a private ambulance medic. That would have been my dream job.
Yeah.
To be a medic
and
have the benefits of the fire department, but not have to go do fire stuff.
Right. And Dan, your department is kind of leading the charge on that.
Yeah, we have them. And unfortunately, it's a stepping stone.
Define single role.
Single role is they are part of the fire department. And they are, they sit at the dinner table with us. Sounds horrible.
I know. We don't put them off to the side.
They don't sit at the kids' table.
Yes. Same uniform.
You allowing them to come in from the rain. Yeah.
Right.
They're not just posting at your station.
But they are hired as a single role. Where what they do is they run EMS calls. So we have certain parts of our department where we have the ASA. We run in 4 different counties. In one of our counties, we have the ASA. And so they have brought a level of pride to the department that they're streamlining it. They're running all these vaccines right now, and the dude that's in charge is a single role guy that's been there for 3 years. And we've given 70,000 vaccines. It's been going on for 5 months, and so they have a place. Mm-hmm. There's still room for us as a department to where their ceiling is not so limited, where they can promote and there's opportunities. That's not there yet, but it's going to be there. But we still have the people that get hired. It's just a stepping stone to get on a big fire truck.
Mm-hmm. The question I was curious about, though, with you guys up there, how progressive do you feel your protocols are? And when you look at kind of where you've come from in the private ambulance sector and maybe other departments around you guys, how do you feel about them? Do you feel like they're pretty good, kind of lagging, top notch? Where you guys fall?
I would say our protocols are pretty progressive compared to other agencies out in the country. I can't say that I know all the protocols, obviously, but we have had some people that we've hired over the past couple of years that have come from other states. More busier systems where protocols are very limited, and they come into our agency and we essentially have to put them through paramedic school again to a degree because our protocols are fairly progressive of having more medications, more evasive procedures that they're just not used to. Like our most recent example would be an individual case in Colorado that couldn't even RSI. Let alone had a third of the drug box of what we had. And that was a struggle for that individual on trying to get up to our speed and our system.
Yeah. And
I would say the majority of the Northwest or the Puget Sounds has those type of progressive protocols. And again, it's that trust again from the medical program director to allow us to do those types of things.
I think that helps with the job satisfaction too. Like you can work to the top of your certification, your training. It helps us to have that autonomy, the challenge of being good at something, the support behind us to go forward and do more. We talked a little bit with you guys at the lab about finger thoracostomies and surgical crikes, things like that are probably going to be coming down in protocols pretty soon. I know a lot of the medics around here do is it considered a surgical crike?
Yeah. Surgical crike.
Yeah.
But yeah, you guys were excited about it. So do you have a lot of say in what's coming down? If you went to your medical director and said, hey, I think we need to do clamshell thoracotomies in the field, would they be like, tell me more? Or would they laugh in your face?
Yeah, every few years, a committee gets formed for our protocols along with the MPD and the medical officers and certain paramedics throughout our entire county. And we're kind of an interesting setup because we're not just a single county protocol system, we're actually a region. So that encompasses 4 counties within the Northwest. So we're all within the 4 neighboring counties doing the same thing. So yeah, we get to sit down with our MPD and review our protocols and say what's working, what's not working, and hey, this is what's coming down the line in EMS. We'd really like to get on board with this and be kind of the forerunners of it. And our program director, the one we currently have right now, is all about that. As long as he knows and trusts that we'll be able to truly be practitioners in medicine and work on those types of skills. One of the things that I love about our system is that we're not that classic Mother May I system. We don't have to call the hospital every time to give a drug or to do a procedure or to talk to a physician on the other end of the line to get permission. We are considered in the medical field practitioners of medicine.
As you should be.
Which is one of the great things I love about our area and our protocols.
Mm-hmm. That's rad. We have I would say down here, it depends on the topic, but I would give us a A-, B+ on our protocols. Mm-hmm. They're not pushing boundaries, but we are doing some stuff that's pretty top notch, and then other things were probably industry average, I would say. But what have you guys felt? I mean, because you reminded me of a situation we've had recently where, so my current assignment is on an engine and a truck station, and we have our probies cycle through and get truck training, truck time with my crew when they're assigned to our shift. And so they'll come down for a month or two during their year on the line and, get some hours on the fire truck. And during that time, I'm, obviously they have checkoffs and tests and stuff they have to take and pass, and we obviously make sure we have time for that. But I'm not immune to the fact that 90% of, what we're doing is EMS related. And so I'm heavily concerned about their ability to show up, take a refusal, for an example, to, get the medic unit back in service, do, a good job of being a QRT medic, right? Where you're, starting lines and getting drugs started, or, starting our cardiac protocols early with a code and things like that. And we had a probie recently who came from a department in the South who has a very limited protocol system for their paramedics. And it was, like you said, it was like taking this person back through paramedic school and having to have them relearn all this stuff because, we're used to going step 1 through 10 and they were stopping at step 3. Mm-hmm. And it's like, no, you need to learn 4, 5, 6, 7, 8, 9, and 10. Like, it was really interesting. And this person told me that, they do, where they came from, they were having basically 2-month paramedic schools, like in and out, 2 months. It was
That's not a 5-star medic.
No, definitely. Wow. Yeah. I mean, if we want to touch on that with our new friends, Jeff and Eric, but
oh boy.
Yeah, it was so shocking to hear that. And then luckily, this person was really, really engaged and wanted to learn more and was kind of a book nerd. And so, threw a bunch of content at them and they did a good job absorbing it and then coming to shift each day and wanting to put it into practice. So,
but do you think when you have someone like that who's already been trained on stopping at step 4, let's say they need to start at step 10, do you think those are the type of people you can, you walk in?
I know what you're thinking there, because Dan has a good memory aid of like every patient you go on has bought a crike prove it to me that you don't need one,
right?
Kind of a thing. Honestly, that level of thinking is so foreign to the freshest minds that are out of school. That's what we, I know I personally teach that with the people that come through our station. But yeah, I guess to answer your question,
it's hard.
It really depends on their base
battle.
education. And then, they have an uphill battle when they've started out at such a, it's really a disservice. Like,
it is.
There should be no 2-month paramedic school in this country.
No.
It's a joke that it's, 9 months in some spots. Like, this should be a 2-year program minimum, and it shouldn't be 1 year of general ed and then 1 year of paramedic ed. It should be 2 years of paramedic ed. But
well, we know from being down in the South, even though, I went to a university for my paramedic school, trying to get my paramedic license in Washington was ridiculous. Retaking tests. I mean, it was really hard. As a nurse, I just needed a pulse rate and a checkbook. And they were like, Washington license, here you are. So going from state to state, and maybe that's why it's so difficult, because maybe Washington and Oregon have high standards, whereas this other state didn't.
Yeah. And I think that's very true. I know that, in doing the business stuff that my business partner and I are involved in with test prep and CE and things like that, we see the full country, and the limits that some states have. Mm-hmm. And honestly, it feels like Washington, Oregon, Texas, Boston, there's some top-notch areas.
Idaho is pretty progressive. I mean, their medics are doing chest tubes and all kinds of crazy stuff.
Yeah. Really, I think any state that has critical care medics and fully functioning flight medics are going to be more than likely the more progressive states.
I do have to say that when I first started out on the ambulance back in the day, I'm only 29, so it wasn't that long ago. It really was like the fire department got there and they kind of waited for us to get on, and this is painting a general
Holly,
picture.
That was me.
It was Dan Livengood. No, Dan would actually go around the block a couple of times, so I would arrive first and cancel them.
They look sick. Yeah. Let's do an extra lap.
Actually, this did happen, so just letting you know.
Okay.
No.
Yeah. No, so we would get there, and it did seem like the fire department kind of waited for us to get there to really do anything. Maybe they'd get a line or whatever. And depending on the department you worked with, because we worked with several different ones. Some of them were notorious for standing outside the door until you got there and then going in with you. But honestly, over the years, I was a medic for 14 years before I went to the dark side. And through the years, I've seen the fire department medics change so much as far as maybe Dan's going to disagree with me, but maybe just their capabilities, pushing the protocols forward a little bit more. We've done the cadaver lab multiple times for the new recruits, and it was awesome. Like to see everybody coming in and doing CPR correctly and using checklists and really growing in just a couple of days that we had them. I don't know. I think it's pretty impressive how it's changed since I started up until now. So even if
it has got better,
it's gotten so much better. And especially like bringing the single role medics in and then having departments like your guys's where you have the transport and stuff like that. So I don't know. I think it's improving quite a bit as far as.
I think if I had to offer a solution to some of the stuff we see where, like Dan mentioned earlier, where people are just, I got to get off the box. It's because they're getting put on a 2-person ambulance in their department and they're getting run ragged and they aren't getting supported. They aren't cycling enough people through that spot.
Or that's the entry level spot and you're waiting to move up.
Yep. Yeah. And, I have a few people in our department right now who, if we offered an incentive, like maybe it's 10% car pay or whatever, which for those that don't maybe know what that is, it would be like a bargaining chip, like, add 10% to my paycheck and I will work the ambulance kind of a thing. And some departments in our area have incentives for that. But if that was available, they would stay on the ambulance forever because
I don't know. We have a $47 a shift incentive.
just covers lunch. Kind of.
That's pre-tax,
No
right?
one cares.
Yeah.
Before taxes, so you get $8.
You know, and I think it comes down to, unfortunately, staffing and, you know, financial support. You know, it's tough, but it does come down to that. And I think if we would have less of these younger and younger people who are thinking like that if we were supporting them more from the top down. It's hard to see, but I also understand on some level, you only have so much money to work with.
Yeah.
You only are supported so much by your city or, you know, local government.
Jeff, you said you work on the ambulance a lot. So when you guys are in the station, you have the engine and an ambulance. Did they take turns with you running calls?
Yeah, so I'm at our biggest station. I have a truck, an engine, our ambulance, and then our battalion is also at the station that I'm out of. And it's like each unit has their own type of call they run, I guess. We on the ambulance, we're always going to run with someone else. Maybe that is the aid car, maybe that's the ladder, maybe that's the engine. You know, it depends on who it is. We always have another resource with us. But then, you know, some calls, depending on how they're coded, like a BLS response, but we call it BLS green here, just like a non-injury fall. That would fall under another resource. We don't send an ambulance to a lift assist.
Gotcha.
Or
So you don't go on every call, just most of them.
No, only, yeah.
Because I agree with you. Like, that would really suck if the other two crews were just sitting there watching TV and you ran your ass off all night.
Yeah.
You know?
And that does happen quite a bit where we're at. We hear that a lot, but yeah, I don't know that we're going to solve that on our podcast today.
No. But it's encouraging to hear
don't
people
think
being
so.
passionate about EMS, because it is 90% of what you guys do. And it's fun.
Yeah, I wanted to circle back. Just sitting here talking with everybody, I'm making some notes, and going back to the private versus fire-based question that Steve, I think you brought up earlier. Just putting myself back in those shoes, remembering some of the things that motivated me to kind of get out of the private sector. It was very business-based for me. The agency that I was at was more concerned about what is going to make them the most money the fastest. And I actually remember getting in trouble for signing too many refusals. Not because I was doing them wrong, but because I wasn't transporting people. But these people didn't need to go.
Right.
But that's where the money comes from. And that's why they exist. And I understand the business model, and I get that they have to make money to exist. But going fire-based, like, our only job is to serve the community. Nothing else. So doing the right thing, you know, like ethically and morally, for me, it was a no-brainer to make that switch. Like, these people that are calling us are the ones that are keeping us in business. So it was much more do the right thing versus money-based coming to the fire side.
When I worked on the private ambulance, we got an incentive for our dry run rate.
Seriously?
Yeah.
Oh my goodness, that makes me so
if it was
sick.
the lowest, we got an incentive for the most calls for the month, which I got every month almost because I work night shift. And then we also got an incentive for dry run. If our dry run rate was low, we got paid more. We got a bonus.
See, like,
That's so wrong.
you know,
And they would post all of our stats on the wall.
That's so
Wow.
messed
Oh,
up.
and see, like, that internally, personally, that just kills me. Like, I could not go to work and be happy with that as a model.
I think that if we're showing up to a call without anything in our brains except what does this patient need and what's going to benefit them the most, if we have anything else going on that's determining what we do for them, I think on some level we're in the wrong. Like,
Yeah.
it's, you know, I had a lieutenant that I worked with for a long time that recently retired, and he would always say, he was the first one that really showed me what it was like to show up on scene and this is your loved one, this is your family member. What are you going to do for them? What would you want them to have? What kind of care? What level of interventions? Give it to them. And, at the end of the day, if they don't need to go, if this was your dad and you wouldn't take him to the hospital, don't take him.
Right.
And obviously give them the option. Like, it's their choice. But if it's a conversation that can be had and you can explain to them what you would do if the choice was in your hands because, you were related to this person, then you can't really go wrong there. You can't really, that to me is very defendable. When someone says, why did you do X, Y, or Z?
Right.
Well, I said, I looked at this person as if they were my dad. And I said, what does my dad need? I mean, oh, okay, well, shoot.
Yeah.
Can't argue with that.
Huge. That's huge.
Thanks for being on and hanging out with us today, you guys. It's interesting to talk to people from different areas. We get kind of, I think, stuck in our ways, in our little circles of life.
I'm a little bit motivated right now.
I know.
Yeah, I think that the debate between private ambulance, fire, and third service is always going to be out there. Yeah.
It's always going to come down to I get to retire when I'm 55 in a fire department, not 72 on an ambulance.
Right. I mean that's a big piece of it. We obviously can't speak for every service that's out there or agency that's doing it right or wrong, because there's fire departments you don't want to work for. I know that for sure.
Oh yeah.
I think more than anything, hearing you guys chat, I just would hope that kind of like what Dan was saying, it's a little motivating to hear you guys have such a positive outlook on the thing that sometimes is the first thing that people want to get down on.
Yeah, thanks for having us. We're always open up to more conversations too. Any topics that you guys come up with and want a different area perspective or what we're doing.
From the north.
Provide that feedback too. From the great Pacific Northwest, yes.
Awesome.
But yeah, no, we really enjoyed being here and we loved having this roundtable conversation with you.
Right on. Yeah, thanks again. We'll leave it there for the day and we will see you guys at the next one.